The United States is releasing more doses of the monkeypox vaccine from a national stockpile as health officials try to contain the global outbreak. At least 7 cases are currently under investigation in the U.S., including 1 confirmed in Massachusetts and 2 presumed in South Florida.
While the exact cause is unknown, experts are warning one group of people to be extra cautious. News4JAX consumer investigator Lauren Verno explains why. Lauren, not everybody agrees with that statement.
Yeah, so that's right, Joy. Health organizations across the world, they're trying to figure out what led to the spread of this monkeypox. One theory includes the transmission of the disease through gay and bisexual men during 2 raves in Spain and Belgium, which led to the CDC to urge the LGBTQ community specifically to be on alert. Even though experts reinforce monkeypox can affect anyone and not just through sex. It could be a matter of days before health officials confirm another case of monkeypox in the U.S. But the disease is nothing new. It was first discovered back in the 50s. If it's been around for so long and it's so common, why are we hearing about it now?
It's gone to 16 nations. It's now multinational. When we see it happen, it doesn't happen typically like that. It happens in isolated areas in travelers. And then many of the individuals who have gotten it this time around have not necessarily traveled to Western or Central Africa.
Over the weekend, the CDC issued a level 2 alert for travelers, which means taking enhanced precautions. But the overall risk to the general public is low. Baptist Health System Medical Director of Infectious Disease, Dr. Shalika Kadugaha, explains monkeypox does not spread as easily as other viruses like COVID.
People develop this rash and you get it from touch.
According to the World Health Organization, the virus can be transmitted by close contact with lesions, body fluids, large respiratory droplets, and contaminated materials such as bedding. Monkeypox is not a sexually transmitted virus. However, most of the cases in current outbreaks have been in men who have sex with other men. But medical experts emphasize anyone can get sick.
No, this is not just affecting LGBTQ people. This is affecting everyone.
Still, some LGBTQ organizations are concerned about the CDC's emphasis on this specific community. A representative from Jasmine said, quote, Jasmine has worked in disease prevention for over 2 decades and is concerned about recent messaging related to the current viral outbreak of what is most commonly referred to as monkeypox. Media messages that specifically focus on gay and bisexual men and imply that they may be at higher risk for this disease will only serve to further stigmatize those groups and interfere with getting prevention messages out to the broader community. The reality is anyone could contract monkeypox if they are exposed. And the CDC says if anyone does develop a new or unexplained rash and believes to have been in contact with someone who had monkeypox, to see a medical professional right away. And at this point, the CDC says that most monkeypox patients in the current outbreak have recovered within a month without any specific treatment, and there have been no deaths reported. I'm Lauren Verno, Channel 4, the local station.